Welcome to Your Health. My name is Dr. Dwomoh. Today we're going to be talking about post-streptococcal glomerulonephritis. Yes, I know it's a mouthful, so it's post-streptococcal glomerulonephritis. Henceforth, we're going to be cutting it short to call it PSGN. Again, my name is Dr. Dwomoh. What is post-streptococcal glomerulonephritis, also known as PSGN? It's a rare kidney disease that can develop after group A strep infection. Why am I talking about this time? Because since the COVID passed, we've been seeing a lot of cases in the emergency room presenting with sore throat, and about 99.9% of the time, they all get diagnosed with strep throat. So hence, I wanted to talk about this PSGN as a sequela or as a symptom, as a result of not having your group A strep treated. So the main way to prevent PSGN is to prevent group A strep infection. So what is PSGN? PSGN is an inflammatory disease, and PSGN is a disease of the kidney that is thought to be an immune response to an earlier infection. Again, it's the immune response to an earlier infection. It's not the group A strep that is causing it, but the body's immune response in fighting the infection. So as the body's defense system, the immune system is important in fighting off infections, but the immune system can mistakenly attack part of the body and cause a damage. So how do you get PSGN? PSGN can develop after infections, as I said earlier, caused by bacteria called group A streptococcus, group A strep for short. These infections include strep throat, scarlet fever, and impetigo. But we are not going to be talking about these three diseases per se, but we're going to be focusing on the PSGN. So PSGN is not, again, it's not a group A strep infection of the kidneys. Instead, PSGN results from the body's immune system fighting off strep throat, scarlet fever, or impetigo. So after the start of the strep throat, the literature states that, or scarlet fever symptoms, it usually takes about 10 days for PSGN to develop. But in terms of the impetigo, it takes about 3 weeks for PSGN to develop. So what we have to know that we know group A strep is contagious, but PSGN is not contagious. Why? Because PSGN is not caused by streptococcus itself, but it's the body's immune system in fighting it. So people cannot catch PSGN from someone else because it is an immune response and not an infection. However, people with group A strep infection can spread the bacteria to others. That's very important. So symptoms usually point to kidney issues, hence the PSGN. The glomerular is part of the kidney. So symptoms usually point to the kidney issues. So what are the symptoms of PSGN? Well, the symptoms may include dark, reddish brown urine, edema. What is edema? It's swelling, especially in the face, around the eyes, and in the hands and feet. And there may be a decreased need to urinate, aka decreased need to pee, or decreased amount of urine. You can have fatigue due to like mild anemia that you may develop as a result of PSGN, feeling tired due to low iron levels in the blood. In addition, someone with PSGN usually has protein in the urine, and they may or may not have hypertension, which is high blood pressure. Some people also may have no symptoms or symptoms that are so mild that they don't seek medical help. So of course, since this is an immune system, some people with some certain medical diseases may be at risk of developing PSGN. So anyone can get a PSGN after having strep throat, scarlet fever, or impetigo. But people at increased risk for those infections are those that are also increased risk for getting PSGN. For example, age. The younger are at risk. PSGN is common in children than adults. That's what, according to literature. And developing PSGN after strep throat or scarlet fever is most common in young school-age children. And it's no wonder that we've been diagnosing a lot of strep throat in young children. And it being contagious, all it takes is one person to have it in a classroom, and then whoever is sitting next to or through sharing of equipment is passed on. A developing PSGN after impetigo is most common in preschool age children. So we can see the strep throat is usually young children, and impetigo is like the lower nursery and the kindergarten. And so, like I said, treatment focusing on managing swelling and blood pressure because it involves the kidney. Treatment of PSGN focuses on managing symptoms as needed. So decreasing the swelling by limiting salt and water intake, or sometimes by prescribing medication that increase the flow of urine. And if you happen to develop high blood pressure as a result of PSGN, then managing blood pressure through blood pressure medication may also be helpful. And treatment may also include antibiotics. And of note that people with PSGN who still have group A strep bacteria in their throat are often provided antibiotics. So you may develop PSGN while you still have the strep infection in your throat. And what are the complications of PSGN? There could be some serious complications, including long-term kidney damage. And hence, most people who develop PSGN recover within few weeks without any complication, while rare long-term kidney damage, including kidney failure, can occur. So these rare complications are more common in adults than children, and that's why we took the opportunity upon us to give this lecture out, because we don't want losing our young adults and children. So protect yourself and others. So the main way to prevent PSGN is to prevent group A strep infection, like strep throat, like we said earlier, scarlet fever, like we said earlier, and impetigo. So getting a group A strep infection does not protect someone from getting it again in the future. They always ask, I got it now, can I get it again? Yes, you may get it again. So getting group A strep today doesn't prevent you from getting it again in the future. However, there are things that you and I can do to protect ourselves or themselves from getting the group A strep again. So what are they? This is simple infectious disease precautions. Good hygiene. Good hygiene is very important. And the best way to keep from getting or spreading group A strep bacteria is to wash your hands. We've been taught several times, wash your hands. Often, this is especially important after coughing or sneezing and before preparing foods or eating. Most of the time, we see our kids sneezing in their palm. It's not recommended. The recommended way of sneezing is to sneeze in your elbow. And if you do sneeze in the tissue, make sure that once you're done, you get rid of the tissue and you wash your hands. And put your used tissue in the wastebasket, like I said. Don't put it back in your pocket only to reuse it. Cough and sneeze into your upper sleeves or elbow, not your hands if you cannot have a tissue. And wash your hands often with soap and water for at least 20 seconds, And use an alcohol-based rub if soap and water are not available. These are all simple infectious disease precautions. And you should also wash glasses, utensils, and plates after someone who is sick uses them. These items are safe for others to use once washed. And again, antibiotics. So antibiotics help prevent someone with a group A strep infection from spreading the bacteria to others. So in a nutshell, PSGN is a rare disorder that is not caused by group A strep, but instead, after you've had a strep infection, your immune response to that can lead to PSGN. So it's my recommendation that make sure that you get your strep throat treated as soon as you have an infection. You feel like your throat is sore, seek medical help. It may be nothing, but maybe strep throat. If it's the strep throat, the sooner it's being treated, the sooner you'll feel, and then the delay the immune system is going to be in developing this PSGN. So again, thank you for your time, and I hope this has been helpful.